Madam Deputy Speaker, tonight I'm seeking an opportunity to shed some light on the continuing saga of Katie Road NHS Walk-in Centre in my constituency of Selly Oak. The future status of Katie Road has been in doubt ever since its fate was placed in the hands of one of the new clinical commissioning groups. My constituents have had to live with rumours, on-off consultations and continuing threats to the long-term future of this immensely popular and highly valued service that sees around 70,000 patients per year. The origins of the service lie in concerns that the large number of students in the area, as well as vulnerable individuals, often with mental health conditions and unstable accommodation, were placing a demand on GP services that could not be met by existing GP provision and was in turn placing intolerable strains on the local accident and emergency services. My own fairly extensive consultations with local constituents have established that Katie Road NHS Walk-in Centre is regularly used by those who cannot easily secure a quick appointment with their own GP, often a problem for those in work, especially those who work unsocial hours, and families with elderly relatives or young children who cannot easily access a GP at weekends or in the evenings. Katie Road sees about 300 to 400 patients on an average weekend. There's now fairly widespread recognition of the value of walk-in centres. The 2014 Monitor Review reported rising demand year on year for the service, with about 70% of centres surveyed reporting they were seeing an average 20 to 45,000 patients per year, as opposed to anticipated attendances of between 12 to 24,000. Yet, despite the demand and support for walk-in centres, local commissioners have closed more than 50 walk-in centres since the start of 2010, further reducing services at 23 others and reducing overall capacity by about 20%. I'm not aware that, other than the Monitor report, there has been any substantial review into the particular impact of this loss of provision. I wonder if the Minister is in a position to enlighten me, and if he might also take this opportunity to say what the Government's position is with regard to urgent care generally and walk-in centres in particular. I did notice that the Department of Health consultation refreshing the mandate says that we want to improve people's access to primary care through new forms of provision, including rapid walk-in centres. In early 2013, Birmingham Cross City Clinical Commissioning Group announced plans to consult on the future of the Katie Road Walk-in Centre. This was apparently based on a report commissioned by the former South Birmingham PCT, a report which remains secret to this day. I first asked to see a copy of it in March 2013. In June 2013, the CCG called off its plans for the walk-in centres, and it was announced that they had been saved, only for the chair of the Clinical Commissioning Group to later reveal that they planned to temporarily renew the contract and that Katie Road had in fact been saved for a period of 12 to 18 months. Later, the CCG announced that it planned a two-stage consultation with a pre-consultation phase and then a main consultation with the public. Naturally, I wanted to ensure that my constituents had their say on this matter, and when I consulted them, I discovered that over 72% had experience of using the centre and we're firmly opposed to any plans to close it.
The honourable gentleman for giving way, and I absolutely agree with him that walk-in centres have the ability to take pressure off overworked A&Es. But would the honourable gentleman agree with me that the best way to take pressure not just off A&Es but walk-in centres too is to have our GP surgeries open 7 days a week so people can access services overall?
Indeed.
I might agree with that, Madam Deputy Speaker, but one of the problems in my area is that the GP surgeries are being cut down as well, so that's not really the answer. As I say, 72% of people had experience of using the centre. Were firmly opposed to closing it. 56% of people had used the centre for out-of-hours emergency treatment, and 55% expressed serious concern over any plans to move the service to or near the accident and emergency unit. My findings are consistent with that of the survey conducted on behalf of NHS Central Midlands Commissioning Support Unit in 2012, which found that more than 2/3 of patients surveyed at 8 walk-in centres and urgent care centres across Birmingham and Solihull indicated they had attended because of an access-related issue, such as they could not get their GP or would have to wait a considerable time to be seen. Major objections from my constituents to relocating their walk-in centre to the main hospital included the distance, waiting times, parking and accessibility. I have personally witnessed during a visit to Katie Road an ambulance crew bring in an elderly lady in need of stitches to a leg injury rather than take her to the A&E unit because of their concerns over the likely delays. And of course, the CCG's own figures suggest that an average visit to the walk-in centre costs around £45 as opposed to £75 to £100 at A&E. I'm aware that there are many examples of walk-in centres being co-located with other health or social care services, and that some have a pharmacy on site or are co-located with diagnostic services such as X-ray provision or dental facilities or family planning. But I should like to ask the Minister if there's any evidence which shows an obvious advantage in co-locating an urgent care or walk-in centre alongside an A&E unit, especially evidence which would outweigh such negatives as distance, waiting times, parking and accessibility. In fact, isn't it the case that most walk-in centres have a limited ability to refer patients on to secondary care services, as patients needing a referral to secondary care are normally referred by GPs, who are the traditional gatekeepers, and this role has, if anything, been strengthened as a result of the reorganisation of the NHS. In autumn 2013, the CCG commenced their pre-consultation. The chair of the CCG met with a number of my constituents in February 2014, where he heard clearly their desire to retain Katie Road and their objections to a plan being pushed by the CCG to relocate the walk-in centre to a site at the University Hospital Trust, Birmingham, adjacent to the hospital's A&E unit. In July 2014, I invited the chair of the CCG and a number of his staff to take part in a second meeting attended by over 80 constituents. We were actually limited by the size of room, or it would have been many more. At that meeting, they heard quite clearly once again that there was total opposition to the closure of the walk-in centre and plans to relocate to the hospital. That review consultation eventually fizzled out with the promise of a bigger and better consultation planned for later in 2014. Arguably.
I thank my honourable friend, Madam Deputy Speaker. The issue here is quite
a difficult one for all of us in our constituencies when we have these walk-in centres that have been closed down. And it's no good opposition members saying that we will have a 7 days a week GP services, because truly what they've done already with the junior doctors dispute shows that they're not capable of doing that. And what it means is that our constituents will continue to suffer, and particularly those who are at work are not able to access that, and therefore putting themselves at greater risk through further misdiagnosis or undiagnosis of that facility.
Well, my honourable friend will know very well, in his part of Birmingham as well as my own, there is actually a problem with GP provision at the present time, so it's difficult to see how it could be stretched further. As I say, Madam Deputy Speaker, we were promised a bigger and better consultation for later in 2014, but that was abandoned in light of the impending general election, the date of which had obviously been known since the Fixed Term Parliaments Act of 2011. No satisfactory explanation for this change has ever been provided, but now, once again, the CCG wants to consult on the future of the walk-in centre. This time, they apparently want to consult on a new model of service, the details of which are known only to the CCG, but a model which apparently hasn't been clinically tested. It appears that once again it involves plans to relocate the walk-in centre to a site adjacent to the A&E unit. As the Minister will know, the Health and Social Care Act 2012, sections 75 to 77, specifically state that commissioners are required to act in a transparent way when procuring services. Transparency is important in ensuring that commissioners are accountable for their decisions, and as noted, commissioners also have a duty to involve the public in commissioning decisions. It's not clear to me, Madam Deputy Speaker, where in this part of the Act there is support for a series of bungled and inadequate on-off reviews and a constant determination to impose one outcome irrespective of the arguments to the contrary. I'd welcome the Minister's view. I am deeply concerned at the continuing threats to this service, which plays such a vital part in the delivery of health care for my constituents. I can't see how the loss of a provision like Katie Road is consistent with the government's ambitions for a 7-day NHS. Perhaps the Minister can advise me on that. Ironically, I've recently discovered that the opening hours of the Katie Road Centre are to be extended to help cope with winter pressures. Dr Lumley, who works with the neighbouring CCG, which also serves South Birmingham, is quoted in the press as saying in response to that announcement, "This is great news for patients in Birmingham and means they can access the walk-in centre until late, 7 days a week." Yeah. Such a pity her views are not shared by her colleagues in Cross City CCG, who assumed responsibility for Katie Road in the carve-up following the introduction of the Lansley reforms. Madam Deputy Speaker, it seems to me that the CCG is clearly out of its depth in terms of handling a public consultation, certainly one that can command any public confidence. What advice and support, if any, does the government offer to CCGs on conducting consultations with the public? I'm curious to know how much public money which could obviously have been spent on patient care, this CCG has spent on its on-off reviews and consultations so far. Is there any limit to how much public money a CCG is entitled to spend on a review or consultation on a single issue? If so, how much? Who ultimately is responsible for making a decision on the future of urgent care provision in South Birmingham? Does the government accept any responsibility for this unsatisfactory state of affairs? And is there anything the Minister can do to help me and my constituents secure the future of this popular and well-used health resource in South Birmingham, which is clearly needed and highly valued? At the very least, could I urge the Minister, following this adjournment debate, to write to the Chair of the CCG and urge him to communicate properly with my constituents and their elected representatives? Stop repeatedly trying to impose plans that have already been rejected and bring this whole sorry state of affairs to a satisfactory conclusion.
Minister, Mr Ben Gummer.
Thank you, Madam Deputy Speaker, and I thank the honourable member for his clear outlining of the case for his constituents and for Katie Road Walk-in Centre, and congratulate him on securing this debate. He touches on a really very interesting issue for the NHS as a whole, and one which clinicians have been grappling in the last few years, which is what is the nature of urgent and emergency care in a world where demography is changing quite rapidly, where demands on the service are changing, and where you have incredibly different and disparate populations. And as he rightly points out, he represents an area which has a high student population, it has high levels in parts of deprivation, and it has a very wide mix of ethnic diversity. But there are other parts of the country which have a significantly ageing profile, which do not have the ethnic mix which he is able to enjoy in his part of Birmingham, and has a different socioeconomic profile. And what is clear for commissioners and for clinicians is that the answer to urgent and emergency care in one area is different from urgent emergency care in another. Now, I know that might be stating the bleedingly obvious, but it was one which was not observed by the NHS before Professor Sir Bruce Keogh initiated his review into urgent emergency care, which he conducted in 2013. And the result of that was a holistic and sensible and coherent plan for how urgent emergency care should be delivered across the country. And the variation in care from Northumbria down to Cornwall is extensive at the moment. There are considerable differences, and he has highlighted how there are differences even within the city of Birmingham. So at the very first, we at least have made progress in the last few years in having a vision of what urgent emergency care should look like. The challenge then is to try and implement that across the service. And that is why over the last 2 years, there has been considerable work by clinicians and by commissioners to try and understand how the principles of the Keogh Review can inform the reshaping of emergency and urgent care in their patches. And as he has identified with the issue about one walk-in centre, and he will imagine how these local controversies become all the greater when it involves accident emergency centres and urgent and trauma centres. These are matters which are very close to the hearts of constituents because they rely on these services. They are there in their moment of need, and in a very real sense they are the single greatest embodiment of the NHS and its values. So how we treat the urgent emergency care has to be dealt with the utmost care in itself. So the plans which are being worked up across the country are being done carefully with commissioners in coordination with NHS England and ultimately with Professor Bruce Keogh. And to give him an idea of why that has been so carefully done and the extent of care that's been taken, it is only in the autumn of this year that the route map for the whole country was published. And I hope he will therefore understand why his local CCGs have had to revise the timetables by which they have been looking at urgent emergency care, because they began their own study of this within Birmingham before, as he pointed out, Professor Bruce Keogh undertook his review. They've had to revise their thinking in the light of that, and I know that they are taking forward their current consultation on the basis of the route maps which have been designed by NHS England with commissioners around the country. Now, he makes a fair point about process, and I know why he's frustrated, and I completely understand his frustration, and I also understand his irritation at the kind of bureaucraties that can fly in his face as a representative of local people. I can't speak for the consultation specifically of which he speaks because I don't have a detailed knowledge. All I can say is that in the NHS there are good consultations and there are bad. And what we have tried to do over the last 5 years, and I'm trying to do in my current position, is to make sure that we level the worst consultations up to the best, and we learn from where they've gone wrong and we make sure they go better. So I can, of course, commit to write to the chairman of his CCG, perhaps highlighting the work that's been done around producing very good consultations, reiterating the points which the Honourable Gentleman has made in his speech, and asking for a clarification around each and every point which he has raised, so that he feels, the Honourable Gentleman feels, that he has satisfaction in raising the issues that he has done in the Chamber, and therefore can provide answers to his constituents, because clearly he feels at the moment there is much confusion and not too much clarity. Now, I spoke to senior commissioners in the South Birmingham CCG today in advance of this debate in order to ensure that I was availed of the facts of the situation. And they assured me that there is a full intention to continue services at Katie Road. Its value is understood and well known, and that's precisely why there was a temporary extension of the hours to 10 p.m. to deal with the winter pressures which are felt across the service. And they also made clear that there has not been a predetermination about the location of a further urgent care centre, that it will be in Selly Oak, it will be considerably larger than Katie Road, so it will be able to accommodate more services and be a greater use to the Honourable Gentleman's constituents. But they've not come to a decision yet about where it should be located, and I know that they will want to engage fully with him and with the community in order to make sure that it goes to the right place. He asks, again, I will of course give way, yes.
Just for a very simple point, I'd like to clarify, I'm grateful to the Minister for giving way. When he was given an assurance that Katie Road would continue, he was presumably told that the contract is due to come to an end. Did he indicate whether the intention is to have yet another rollover contract, or if there is a timescale attached to this consultation, this yet another consultation that's going to take place?
No, I was not assured at that level of detail, but I can again ask for that in my letter that I will send to the chairman of the CCG. But I think the intentions were clear, and they seemed entirely honourable, that they understood the purpose of the centre. They clearly saw that there was a disadvantage to a discontinuity of service of having Katie Road stopping before a new urgent care centre opens. And I think they understand the Honourable Gentleman's perfectly reasonable point that there needs to be some sort of continuity of service so that local people know where to go to and can feel confident in the provision of service locally. Just on the point about location and co-location that he makes, I mean, it's a very important point. Again, it will be different in different areas. He might have local pressures at UHB which do not pertain elsewhere in the country. It might be right, and we're having exactly this discussion in my own constituency at the moment, to make use of an A&E brand and to say, right, you've got one simple place to go to, or perhaps it's right to locate services on a different site. I mean, that will be different for different places. And that is why, under actually the previous Labour government, there was a decision in 2009 to give commissioners a greater role in local decisions on urgent and emergency care, because they are the people who know their patches best. And anything which I might write in Whitehall might not be right for the local conditions in Selly Oak, or for that matter anywhere else in the country. So I cannot give him an answer on co-location because it will be different in different parts of the country. But what I will tell him is that I will include in my letter to the chairman of the CCG a particular reference to the fact that you and your constituents wish to be consulted on this, and that wherever the location should be, there needs to be a clear rationale behind it, so that people feel that it's not done for the ease of NHS land, it's done for the betterment of patient service. He asks about the consistency with 7-day services, and I'd like to reassure him that we're building 7-day services, especially around urgent emergency care and hospital cover, on the basis of the urgent and emergency care networks, which are outlined by Professor Bruce Keogh in his review of 2013 and the consequent work. And quite contrary to the suggestion of his honourable friend, 7-day services are a programme which is entirely clinically led. It is drawn from the work that the Academy of Royal Medical Colleges undertook in 2013, developed 10 clinical standards. That is the basis of the work that we are taking forward. The contract reform that we have undertaken, both for junior doctors and for consultants, is based in part on the recommendations of those 10 clinical standards. And so it is rooted entirely in a need to respond to the top clinicians' advice on how we achieve consistency of service across 7 days of the week. And I would expect, therefore, that the results of any consultation into urgent and emergency care in Birmingham match precisely the overall work that we are doing to make sure that there is consistency of standards across 7 days of the week, good access to patients, and a very clear and transparent approach to urgent and emergency care, which at times in parts of the country, as he has identified, can be both patchy and confusing. And finally, he asks about whether there is a threat to walk-in centres. And I would just like to say to him that under this government, he will see a continued investment in urgent and emergency care. We will seek to find greater clarity around urgent and emergency care, so there is a clearer brand and more easily recognisable services for local people, that we eliminate inconsistencies across the service, and that we fulfil the best clinical advice on how to achieve better services in urgent and emergency care by following the recommendations of Professor Bruce Keogh and the work that's been done by local clinicians since. So quite the contrary, I do not believe there's a threat to urgent emergency care centres or services. I believe that services will improve over the next 4 years. And that is why I am very happy to promise to him now that I will continue, of course, to answer questions on Katie Road. Should he have any further concerns, I would be delighted if he came to me and we could talk about them. And I will do what I can to allay those concerns and to make representations on his behalf to his clinical commissioning group so that he can get the answers that he seeks.